So when you think about telehealth, it's actually seeing patients through video conferencing and being able to make the assessment based on hearing, heart, and lung functions, or viewing sections of the skin or looking in the mouth. All specialties can be treated through telehealth. If not all visits, then visits after the initial visit.
We have the ability to quote-unquote video conference. But more than that, we need an effective electronic medical record. And that's what we have here. So on one screen, I have a medical record that's up. We also have all of our labs computerized. You can certainly look at this on a smartphone. You can look at this on a tablet. It really does make it convenient, especially when you're going from room to room.
The way that telehealth would benefit a rural patient in Illinois, let's say you're coming here to see a doctor for a procedure, for instance, and then the remainder of follow-up visits where the doctor can see you through video conferencing and, essentially make the assessment versus having you drive here each time, 3 hours each way to see that physician.
We talked about your T-cell count before. It was about 350.
One of the mobile carts that we deploy at the originating sites, which would be a clinic. I'm accessing it through the web browser on my phone at this time, but it could very well be done through an iPad, as well as a web browser on a computer system. So it just allows the provider to incorporate this into the flow of the clinic.
So in a computerized lab database, we don't have to shuffle around with papers or anything and worry about faxing labs back and forth between the facility and our site here. We can look at this stuff in real time, and it really helps us to review the labs with the patient.
Telehealth essentially removes barriers for patients to access the physician, removing the amount of time. It can be much more cost effective, for instance, for the patient.